Uh, Probably the same passed in many other countries. During the COVID pandemic, many procedures here were suspended, and the surgical patients did not have the opportunity to do exams as outpatients, colonoscopies, endoscopies. And in reason of that, probably will have many patients that were not diagnosed during this period, and they will be diagnosed, especially talking about oncological disease, colorectal cancer, and so will be diagnosed with a more advanced disease, and they will probably have more, well, probably will have a worse treatment and so on. So up to now, we don't have a plan. If we're talking about the healthcare system, the government is still facing all the difficulties with the pandemic, and they're not talking much about how to deal with the surgical patients in the near future. Brazil is a very big country, and we have this issue, which is not an issue, it's a feature of Brazil, but this leads to many different kinds of health treatment for patients in Brazil. So you will have patients that live in an area that the treatment is very accessible, as in São Paulo. So patients living in São Paulo probably did not have such a big delay on their treatment. Meanwhile, some patients living in the north area, like in the rainforest or in the northeast, they will have much more problems in this near future, because the pandemic is still going on really hard, really bad in these areas, and we don't know when it will end. So in the beginning, we were horrified. We were scared. Everybody was really scared. And well, I live in São Paulo, and all the hospitals shut down everything, just waiting for COVID. And they realized that probably, especially here, when I'm talking on Brazil, I'm focusing more on São Paulo, the place where I live in, that the cases were going to be a lot, but not enough to close down all the hospitals and stop everything. Here in São Paulo, we stopped for a while doing operations, but we are now doing operations and different uh, buildings, and if we're trying to isolate COVID patients from non-COVID patients or COVID-free patients, as we've been calling them. And I think it's a big issue for everybody, for all countries. I think São Paulo behaves kind of uh, a country with good medical facilities, but absolutely we have many other small states here in Brazil that are going to chaos. And surgical patients definitely, it's their least problem at this moment, you know. COVID will not disappear. I don't think in 1 or 2 months we'll be COVID free forever. So from now on, I believe we'll take care of not being infected during the operations and during all medical cares and appointments. So I think screening for COVID will be really frequently in patients going for elective operations, and as until we'll have a vaccine or something that can prevent us from the infection. So in the near future, even if the pandemic is gone, I believe we'll keep doing all this prevention that we learned during the pandemic uh, and for a while, for a while. I don't know if forever, because as we're seeing, life changes very quick and very frequently. And but at least in the near future, I believe we'll be facing this.